Welcome, everybody, to the best hour in town. Of course, the happy hour of Keystone Advisors. I am so happy that we have the opportunity to connect again. Remember, we were concentrated in our selling seasons. That's why we had to skip. But we're back, and I'm very excited about to share, once again, vital information for all our agents, for all our colleagues out there in a very relaxed way. Of course, happy hour time. So be ready because this is about to start. And now I have the opportunity to introduce you to the best person that we were able to acquire here at Keystone Advisors that is making changes like you have no idea for the best. Not other person than my friend, Leo Volosin. Leo, welcome to the Keystone Advisor Happy Hour. And before we get to the topic, please tell everybody, how you got it, how you get here.
Well, thank you so much, Rudy. It's a pleasure being here with you and every day with you. It's an excitement working along Rudy, Veronica, and the whole team here. This is an amazing place. Most of us work here from the heart and, really enjoying what we're accomplishing and what we're building, and we're just beginning. My background, I just started in this about 35 years ago.
Yes, right.
It's been an amazing ride so far. I've been a little bit of everywhere. I started in the value-based when we used to call it HMO, right? When nobody knew what Medicare Advantage was, right? And continue on to individual plans, Medicare plans, Medicaid. Was in the Medicaid sector. So large group, small group. I've done it just about a little bit of all in this industry with some great organizations like Care Plus down in Florida, then acquired by Humana. I've been around the block for a while now, Rudy, but really enjoying myself more than ever now with some of the accomplishments that we're doing over here and reinventing the wheel with all the problems there is in healthcare, as you know.
I agree, and I am so happy now that I have you in my corner because I needed someone like you that also can bring all these years of experience that you're bringing to Keystone and to the Keystone's broker. So I am so happy that you're part of this team. And again, working with you is also a pleasure. I like your passion. I like that not only we share a few things, but among that what I like more is that you also would like to empower the agents, the brokers, with the ammunitions to go out there, not only to be productive and make sure they're able to provide for their families, but also to do it the right way, to make sure that they do the things the right way. That way they can last they have a longer career in this industry. Yeah, man, I'm very excited. So I'm glad you're here. So cheers for that, my friend.
There you go.
Cheers. So, of course, we're in happy hour. So, and all of the things that we were able to talk about, and like you said, I mean, right now with all the changes that we're going through in this industry, I loved that we agreed in a very important topic that was create or find a solution for a lot of people that will that's been affected for all the changes that's happened in our industry. Immediately when we had that conversation, I know that your brain start, clicking and looking for those years of experience that you already have about something that we can present to our brokers that they will be able to facilitate to members that will have the benefits of having a solution. So that was kind of like the beginning of a great idea that you and Veronica put together. And when you guys came up with the name, I was like, Jesus, that's it. So Ladies and gentlemen, now for the first time in our podcast, I would like to introduce you one of the best solutions you will see out there for what's happening now, and it's called Health for Less. Health for Less, my friend. So, and one of the creators, the minds that create this idea, is right here with us, Leo. Please share with us how you guys put this together and basically what is Health for Less.
Well, a lot of people who know me know my history, right? My background, I'm Argentinian, right? Came here when I was 2 or 3 years old. I'm an immigrant, just like everybody else who either came here 3 years ago or 5 years ago, right? My father, been in the industry for 60, 70 years, also in managed care. But about 20, 30 years ago, he said, we need to create products that are for the individuals that maybe don't qualify for Medicaid, can't afford traditional insurance. And that's before the ACA, or as we know it as Obamacare, came out, right?
Exactly.
And it was a similar problem back 30 years ago, right, where people weren't going to the doctors. So he created a discount product out in the community back in that time. And I saw his passion, and I spent several years running, that type of organization and realized how many people it was helping, right? I never thought that in our industry we were going to run into that again and have millions of people uninsured. So when I got here, one of the things that I enjoy about Keystone and Veronica's leadership is that she wants to help. Not only, it doesn't matter what nationality you are, what color skin you have, if you speak Spanish, English, or are from an Asian background. It's very open about her heart wanting to give back, right? And how you want it and how your background is, Rudy.
Correct.
So our thing is, I loved it. I fell right into where I needed to be here we're in Houston, but we're a national organization, right? So I'm super enjoying. So this product, when Veronica says, hey, we need to create something for the people that are going to get stuck without health plans, whether they have Social Security or they have Social Security, or they, can't qualify or can't pay, because we know what the prices went up, Rudy.
Yeah.
It's crazy. I mean, if you look at some of the prices in the ACA market, it's almost priced out people. We came up with Health for Less. And I am extremely excited because this is one of the better medical discount plans that has, I think, ever been sent out in the market, because it has the mentality of us in the insurance industry. It's not an insurance product, but it really looks pretty. I mean, it looks nice, right? Has some amazing benefits on there. So yeah, it's super exciting to be able to kick this off.
So wait a minute. So you're telling me that we are offering the opportunity, okay, for all those in needs to have a solution that will allow them to have access to certain medical care without asking their immigration status,
At all.
without asking if they're qualified for subsidies or not.
That's right.
They do not have to go to the
There's no qualifications
there's
at
no
all.
qualification,
Yeah.
and they will able to receive those services they're seeking to get.
Yeah. With
Health
some
for
of
Less.
the top medical facilities, without me mentioning names, right? Some of the top medical facilities, not just here in Houston, but
Nationwide.
nationally.
Yeah, okay.
So it's created in a way where they're not only gonna be able to go into an application and look at the doctors, but like most medical discount plans won't do, we'll set up appointments for them. They're gonna give them a lot of free services. Everybody who knows me, I'm an animal lover. There's even telehealth for animals.
I heard that.
Right?
I heard that in the presentation.
Yes.
So when we put a group of benefits like that, the first thing that comes to my mind is like, hey, this has got to be probably like a very expensive product. So, I mean, how affordable is this thing?
Rudy, it is an expensive product. It's a very expensive product. But with the help of this organization and our contacts and what we were able to go out with, where we found, all these benefits through an organization, it's feasible, like I said, for individuals that don't qualify for ACA or can't afford ACA, people that were used to paying zero in the past. So we made this product extremely affordable. It's not cheap, it's just affordable.
Correct.
And what I mean by that is that it's priced well for a whole family so that they can afford getting doctor visits. I do not want to see somebody not be able to take their kids to the doctor because they can't afford it or scared of going to an urgent care, right? We put all the tools and all the whistles, telehealth, dental, vision, prescription drugs. We have it all in there. Help in navigating bills.
That's awesome.
Okay.
That's awesome.
And then, and everybody's, always picking up the phone now and seeing how they can, make something a little easier and how they communicate with a counselor. You're having personal issues. It has everything built into this system of medical discount program to assist somebody, where they need it most. Getting to a doctor, in the sense of where do they go? We created an amazing, app that was created just for this so that they can, actually go through the webpage and look at what doctors are and what zip codes. The organization that we've also going through is really A-class on providing a good quality product out there.
Okay, so but the most important information is that it is not a health insurance.
That's
okay?
very important to know.
It's
that
not a health insurance, but will allow those members that are in this plan to perhaps go and see the doctors that they would prefer.
It has a great system. So it has a provider directory,
Exactly.
like a lot of managed care companies out there have. This is a discount card. Let's repeat that 100 times. Make sure nobody gets confused, right?
Correct.
But it has a better system than a lot of, and we've seen it, Rudy.
Yes,
We've seen,
yes.
The actual web page for it where you can find your doctors, your specialists, just about everything, vision, dental. It has a great way of pricing out your RX.
Yes, I saw that.
More important is, as we know, as a lot of individuals, because of either immigration status or they're in transition, they're even scared to go to the doctor. This actually picks up the phone and helps them make an appointment in their language. So it's it's built to assist individuals that can't always afford health care but need health care. So
Correct.
this is in the perfect program to assist those type of individuals. So priced well, and whenever you're ready, Rudy, you say that price, but priced well.
And it's live now, right? I mean, we can go and enroll individuals right now.
You go right now.
So, guys, Keystone agents, the call is to you now. Please communicate with us. That way we can provide you not only with access to these great solutions, but also with the training. We're going to train you in how to offer and how to maintain your book of business with these new solutions. And I love the fact that it happens in a very crucial moment because we were all discussing what's going to happen with this individual. I mean, if you have a marketplace book of business, you probably have that in your mind. It's like, what am I going to do with my members that for XYZ, they're not going to be able to qualify through their existing plan that they have? Well, we thought about it. We brainstorming, and I'm glad that now I have, the Argentinian crazy soccer lover here, because he loves soccer just like me, putting these ideas together. And yes, it's called Health4Less, and it's active, and that is the website also. And should we kind of like tell them about how affordable this thing is?
Why not, Rudy? I think it's good.
I think it's good, right?
It's why we're doing this. It makes me super happy to be able, as it's already been out in the market for about 2 weeks and selling like crazy, and really giving the help to the individuals that need it. And you're seeing it. You're seeing our phones are ringing, and
Yes.
it's a good feeling to be able to assist.
And another thing that I noticed is it's kind of like built for the way a family used to select in the marketplace, right? So it is a family membership. So you can get either one adult, two adults, but as many kids as you have, as long as they're your dependent, and can go from just like I said, one adults to 8 members for the whopping price of
$39.99.
$39.99, guys.
That's all it is for the whole family.
$39.99.
Yeah.
Yes, is a monthly subscription of $39.99 will allow you to be part of this great group of discounted services that are put together in a very professional way, a great websites to navigate to get you exactly what you want. That explains all the services. It tells you with videos. I mean, what I liked it is that they have videos that explain how to use it. So it's very user friendly. But on top of that, we are going to be training our agents, our brokers, that they can really take care of their members with this type of solution. So if you're there kind of like thinking, what the heck they're talking about? Well, we're talking about the answer, the respond to what all our brokers are dealing right now. It's how am I going to give an answer to my member that it's no longer qualified for a marketplace product? Well, guess what? Keystone Advisors put together a great product that is called Health4Less, that for $39 with 99 cents a month, you are part of this elite, great group of individuals that have the opportunity to take the advantage and the benefits that are built in, okay, with this great solutions.
Rudy, let me give you some other little pointers that we can give. The product has telehealth at $15, unlimited, and it's a physician answering the call. So they can pick up the phone. Within an hour, they're going to have somebody call them back, and it's going to be a physician where they can do a telehealth call.
Wait a minute. This is important, Leo, because it's a physician, so that means that if they get a diagnosis, that the physician will be able to prescribe medications also?
Correct. So in the system, they're going to put their most, and I was running it, which one is their closest pharmacy, and they're going to be getting a prescription. And if it's a 24-hour pharmacy, that's where they're going to go. Yep.
Awesome.
And not only that, it's unlimited. So you've seen all these programs that are charging X amount of dollars just for the telehealth piece. That is more than what we, charge for this product, right? Which is amazing. So for $15 unlimited, but it's not only that.
Oh, yeah.
We have 24-hour nurse line that they can call in just to see what treatment they're getting, if it's right or it's wrong. This nurse hotline will provide them with all types of assistance. That line will also provide them help with billing, questions, what kind of doctor I should really be seeing, or it can also do. You can also do telehealth dermatology, Rudy.
Oh wow!
Yeah, dermatology you can do which has that has a little separate payment, but it's very affordable. Okay. They also have a program for, diabetics, individuals with high blood pressure that actually help them with treatment programs for those types of individuals.
This is incredible.
Do you know how much you really got to pay? And something, that I kept on saying from the beginning, it's super important to have counseling, right? Mental health counseling. You're hearing all these things going on in the world. It's tough. A lot of changes in this, in individuals, and they need to talk to somebody. Well, they give them 6 free initial consultations. And,
six
free initial consultations. So the program, I can be here for hours.
I know,
Rudy,
I know,
you know,
I
and,
know.
and
I know,
but
because it's very robust. It's very complete. It's actually, that's the name. It's like complete package. I think that's the
it's the
name that we
complete
put together,
package.
right? It's a
That's right.
complete package that, yes, guys, includes all the needs that everybody is looking for. For example, X-rays, lab works, helps in prescriptions. I mean, yeah, and the provider directory, it's like one of those providers directory from the national carriers. You put the zip code, you put and what's the distance that you want to look for the providers, and boom, it gives you a list of all the available providers. They are part of this great group. So it's, I mean, like, yeah, you're right. We can probably talk about this crazy.
And anybody who knows me, Rudy, knows that I love my Lola, right?
Oh, that's right. That's
So
right.
you can't forget that. So my Lola would get mad, right? So it has tele-vet appointments over the phone. Just, let's say it's 2:00 in the morning because it's 24 hours a day.
Oh, wow.
So if it's, and something happened, your dog, your cat, hey, your horse, I don't know. I'm not sure exactly if it does
we're
the
in
horses,
Texas. Hey,
but
we're in Texas.
you never know. So,
Yeah.
but it provides you with a vet consultation, and they're going to tell you, hey, no, you need to run to an urgent care and make sure this dog's, or your cat's okay, right? Or they're going to tell you no, so it's actually a veterinarian. It's not some, answering calls there. So it's again, I love my Lola, so it's important to make sure I have that.
And another thing that just came to my mind.
Yeah.
This is a nationwide product
That's right.
that you, as a customer, the customers will be able to use it without restrictions nationwide.
That's right.
And guess what? You, as a broker, you'll be able to offer this nationwide without the need of has a state license in other states.
Yeah, that's right.
That's right. So
That's right.
if you have your license, if you're a broker working in one state, I know that we have great brokers that have several states. But if you have just one or two states, this product you will be able to offer nationwide.
Yep.
Without the problems of not having that state's license.
Correct.
That's another thing. That's another thing that just popped in my mind.
And I know we're going to talk about this in our next podcast, but it works very well with other products, right, Rudy?
Correct. And yes, that's going to be the part two.
Part two.
Part two is that we're gonna train you and we're gonna empower you to put something like an armor to this type of solutions that protects not only every single thing that we're talking about, the benefits that your client will receive, but how also can improve the utilizations of this benefit. So, oh my God, I'm very excited, Leo. This is going to be the year of Keystone Advisors providing these type of solutions, not only for us, the brokers, to go out there and kill it, but also to be able to talk to our book of business, to our acquaintance, to every opportunity that we have to say, hey, I got a solution for you. You are struggling to try to get something that, perhaps if your conditions are no longer available to you, boom, an agent from Keystone Advisors got you, baby.
And you know what, Rudy? You know what makes me really happy about this product is that I call it helps three, right? What do you mean it helps three, right? What is that, right? Well, I said, you got to make every piece of healthcare work. One of the biggest problems there is that if it all doesn't work, so we definitely know that we're taking care of the customer, right? The individual that really needs these benefits, right? And that's important, because if not, then why did we create this product, right? So we know we put a product together that's very, very affordable and usable, right? The second thing is, you got to have a network of doctors, right? And you mentioned it. And you got to make them happy. And this is a great business because, one of the biggest things that doctors have is timely payments, right? So with this program, even though it's a very well discounted rate for the member to go there, right? But they pay at the time, right?
Exactly.
So once they leave, it's paid.
Exactly.
So they left
Correct.
that primary care doctor and it's paid. That's it. It's done.
That's it.
Right? But then there's a very, very, very important piece that we've been quiet. I'm not going to say the number today, right? But there's a commission to this because,
Correct.
we all got to be, taken care of, right? And I'll tell you what, the commission structure we put together is
I like it.
It's extremely well.
I
It's
like
extremely well. And that's something that would be important for everybody to reach out and call us so we can give you that little secret, right? Because I'm going to tell you, you're going to be extremely pleased.
Absolutely.
And rewinding a little bit for chapter 2, right, which is our second podcast, is how they're going to put our product together, which is already amazing on its own, with another product. And I can almost, because I'm being listened to, right? I don't want to say for sure, right? But I can almost tell you that it's more than you make with ACA.
That's right. We're going to have all those details right here at your headquarters at Keystone Advisors, provided with more information, providing you with the training, and providing you with all the tools you need to have this in your portfolio for your clients. So remember, right here at Keystone Advisors, we're creating these opportunities and these solutions for you, the broker. So if you need more information, please visit, subscribe, make sure you liked us, make sure you get in touch with Leo, with me, and make sure that you are part of this revolution, because the solutions exist if you get to connect with the people that have them. Keystone Advisors. So we'll see you in the next podcast. Remember, it's 5:00 somewhere. Happy hour, Keystone Advisors.
Thank you, Rudy.